Welcome to this edition of Time with Dr. Mahama. Be fruitful and multiply. Genesis chapter 1, verse 28. Last episode, we looked at male factors contributing to infertility in the couple. Today, I'm looking at female factors contributing to infertility. Infertility is defined as a disease of the reproductive system in which there is the inability to achieve a clinical pregnancy after 12 months or more of regular, unprotected sexual intercourse by a heterogeneous couple, that is male and female. In primary infertility, the couple has never achieved a pregnancy. In secondary infertility, the couple have had at least one previous pregnancy, irrespective of the outcome. The chances of spontaneous conception in a given menstrual cycle is less than 20%. The World Health Organization, WHO, published a new report that says that 17.5% of the adult population worldwide, that is 1 in 6 couples, experiences infertility. In 10% of the couples, no factor can be found in the male or female to account for infertility. This class of infertility is described as unexplained infertility. The causes of infertility in a woman can usually be traced to 1, either the uterus, that is the womb, the fallopian tubes, or the ovary. The ovary is subject to the influences of the thyroid gland in the neck and the part of the brain called pituitary gland. The following events are required for pregnancy to occur. 1, release of the egg from the ovary, that's ovulation. 2, the coming together of the sperm from the man and the egg from the woman, called fertilization. And 3, the fertilized egg must plant itself in the prepared lining of the womb or endometrium by the process called implantation. The effort to find the cause of infertility in a woman starts with the history. The first interview should start with the couple together and later individually with the man and the woman. The following are the key factors in the history. The sex or coital frequency, that is, how often do they do sex? If the couple do sex once a week, they have a 17.5% chance of a pregnancy in 6 months. And if they do it 3 times a week, their chances are 50% in 6 months. I generally advise my patients looking for pregnancy to do sex 4 to 5 times per week. So that's sex frequency. 2, ovulation. For a woman whose menstrual cycle is irregular, is regular at 28 days interval, ovulation occurs on day 14. When the egg is released, that is ovulation, it can survive in the woman for 24 hours, and if not fertilized, it shrivels. On the other hand, when the sperm gets into the woman, it can survive for 3 days and can still fertilize the egg when it is produced. Hence, I generally tell my patients to do sex during the 4-day time window in the middle of the cycle. 3, details of the menstrual cycle are important because from the history, the suspicion of conditions like polycystic ovarian disease syndrome or endometriosis may come to the forefront. Severe pain with menses may suggest endometriosis. Irregular menstrual periods suggest anovulation or the woman does not release eggs regularly. 4, history of previous abdominal or pelvic surgery can indicate compromise of the fallopian tubes. History of ectopic pregnancy means we may be working with 1 fallopian tube instead of 2. Previous dilatation and curettage, or DNC, may also indicate tubal factor for the infertility. 6, history of sexually transmitted infections such as gonorrhea and pelvic inflammatory disease points to scar tissue in the tubes or around the tubes called pelvic adhesions. Medical history of a disease like diabetes or goiter can influence ability to get pregnant. History of previous treatments, including herbal treatments. I've had patients who inserted herbs and other chemicals leading to the obliteration or scarring of the birth canal. This often leads to difficulties with sex due to the gynecomastia or closing of the birth canal. 8. Diet and lifestyle. These are all contributing factors in infertility. Substance abuse, for example, including alcohol, may not only cause infertility, but also cause congenital problems in the newborn baby. 9. Age and fertility. We have seen from the case of Abraham and Sarah the effect of age on fertility. At puberty, the girl child has 400,000 eggs in the ovaries. These eggs shrivel with the process of growing old, and at menopause, there are virtually no viable eggs. Initial complete examination from head to toe is essential to make a proper diagnosis. For example, milky discharge from the breast may suggest high prolactin levels, that's hyperprolactinemia, and this can affect fertility. Like and share with family and friends, and tune in next time. Thank you.